Welcome back to Medicare Tales and Marshmallows, where we untangle the noodles of Medicare over warm fires and stickier conversations. Today's guest is the ultimate paradox, a retired top exec who could buy the marshmallow factory, but instead she shops the clearance aisle of Medicare like the rest of us mere mortals. Please welcome Vivian S.
Cam, if there's a coupon for life advice, I'd clip it.
Vivian, let's cut right to it. You've got resources, you've got options, and yet you went with a high-deductible Medicare Supplement plan with lower monthly premiums. What gives?
What gives? Control gives. I wanted a plan where I could pay as I go, not as they say. I'm not afraid of a deductible. I just want the freedom to choose where I get care, when I get care, and who's poking me with a stethoscope.
Okay, I hear you, but a high-deductible Medicare Supplement?
Let me tell you, I've spent my career analyzing risk, and I didn't get to be a 1%er by spending like a drunken sailor. Lower premiums with high deductibles don't scare me. Random prior authorizations do. Network restrictions do. An insurance paper pusher or AI bot denying my MRI, that's terrifying.
Exactly.
But seriously, Cam, I live in a big city with world-class hospitals on every corner like Starbucks. I wanted access, plain and simple. Plus, the premiums on the high-deductible plan, practically pocket change compared to what I was paying for luxury car insurance.
So it wasn't just about saving money on premiums, it was about buying flexibility.
Exactly. And okay, maybe a little about saving money. I mean, who doesn't love a good deal? I can self-fund the deductible if something big happens, but why overpay every month when I'm fit as a fiddle and obsessed with Pilates?
Any surprises along the way?
Oh, a few, like when I discovered I still had to pay the first $2,800-ish out of pocket before Medicare Supplement kicked in. I had a brief moment where I thought, should I have gone with a Plan G? But then I remembered I like seeing my savings stack. It's like calorie counting, but with money.
And what about the extras? Dental, vision, all the sparkle Medicare Advantage folks like to brag about.
Oh, I handle those a la carte. My dentist's waiting room has better coffee than my condo's lobby, worth every penny. And I like shopping for boutique eye care. I call it executive customization.
Vivian, you make it all sound glamorous.
It is glamorous. What's more glamorous than paying for exactly what you need and nothing more? It's like minimalism, but with a platinum credit card.
So far, any moments of doubt or regret?
Yeah, a few, Cam. There's been one or two moments for sure.
What? You had us all admiring your savvy. Low premiums, total flexibility, a la carte perks. Now you saying you had a moment of regret?
Oh, it was a humbling moment. Picture this. I'm on my way to my standing Saturday morning yoga Pilates fusion class, carrying an oat milk latte like a proper urban health nut. Next thing I know, I miss a curb, twist my ankle, land dramatically, marshmallow latte airborne.
Ouch. Oh no, wait. Was the latte okay?
The latte had no chance, but forget the latte. I ended up in urgent care with a severely sprained ankle. X-rays, specialist follow-up, the whole thing.
And that's when the high-deductible monster reared its ugly head.
Front and center in 3D. Everything before that $2,800 on me. My credit card started sweating. For a brief, deeply caffeinated second, I thought, did I outsmart myself? I was calculating physical therapy costs in my head while they wrapped my ankle.
That's when most people start second-guessing the high-deductible path.
Exactly. I thought maybe I should have gone with a standard Plan G. Maybe a Medicare Advantage plan would have given me urgent care copays instead of this DIY expense extravaganza.
So what made you stay the course?
Perspective. I tallied up the premiums I'd saved over the past year. It covered most of my out-of-pocket costs for the ankle saga. And guess what? The flexibility to see the top ortho in the city, no network restrictions, no prior authorization hoops, that was priceless.
So even when the bill came, you still felt like you won.
I paid the deductible, sure, but I got treated fast, by who I wanted, where I wanted. I didn't have to call the health insurance plan advocate for permission, and I healed quickly because I wasn't waiting around. So yeah, overall, no regrets. I can walk into any hospital, any specialist's office, and I don't need to ask, "Are you in network?" I just ask, "Where's the good coffee machine?"
Right.
The deductible, I treat it like a runway fee, cost of flying first class.
Sounds like you've made peace with your latte sacrifice.
It was a really good latte. Let's have a moment of silence. Okay, moving on.
Vivian, you're a legend. Thanks for reminding us that the high-deductible life isn't just about saving, it's about control, with a side of risk.
Exactly. And now, Kem, pass me that marshmallow, but make it a double. I've got high deductibles to meet.
Vivian S., the queen of high-rise living and high-deductible strategy, thank you for sharing your stories. There you have it, folks. Vivian's tale shows that high-deductible Medicare supplement plans can work beautifully for people who value access, flexibility, and have the financial cushion to cover large out-of-pocket costs when needed. Until next time, stay safe, healthy, and keep those marshmallows delectable.